White Sox star Eloy Jimenez tore his left pec. This occurred during a preseason game yesterday where he tried to rob a home run and essentially hung his left arm over the barrier. Let's discuss this injury in more detail. For those who don't know me, my name is Sonam, and I'm a resident doctor specializing in sports and exercise medicine. On this channel, I break down injuries as they happen so that average fans can better understand what's going on. Be sure to like and subscribe if you want to stay up to date. For now, let's discuss this brutal tendon rupture. So this is the initial injury Eloy sustained. And as you can see, he's essentially throwing his arm in a compromised position over the barrier to try to rob a home run. Is that the smartest thing for a preseason game? Ideally not. You put your arm in a very compromised position. It almost looks like a dunker putting their arm into the rim after they're finished a dunk. And if he comes back down, he's in noticeable pain afterwards. So the one thing I wanted to show everybody here is that the trainer is actually looking to see whether or not he's dislocated his shoulder. Super important because that's something you actually want to relocate on the field or in the locker room if possible. So let's discuss this pec tendon rupture. So essentially your pec is a series of two muscles. You have your pec minor, which is one that no one really talks about, and we're going to ignore that for this video. And then you have your pec major. Your pec major attaches along your clavicle, your sternum, comes around, twists a little bit, and attaches on the top part of your humerus, which is this here. So the pec has two main muscles. The first is that it adducts, so you can bring your arm in, and think about a fly, okay? The second is that it helps push out. So that's your traditional bench press or push-up position. Now, there are a few main places that this can tear. First off, pec tendon ruptures are actually super rare, happen mainly in males who are 20 to 40-year-olds who really push this tendon to the limit. So think weightlifters. I'm sure you've seen some videos on YouTube where the pec tendon is completely ruptured during a bench press. Now, the pec tendon primarily ruptures in this area. So it's the insertion of the pec tendon into the upper head of the humerus. There's also this area called the myotendinous junction, and that's the second most common area. Pec ruptures of this area of the muscle, super uncommon, and then pec ruptures from this area, the clavicle to sternum, even more uncommon. So this is where we're suspecting Eloy has the pec tendon rupture. So how do these rupture? So mainly this ruptures under an insane amount of load while your muscle is eccentrically contracting. So an eccentric contraction is when you're, for example, doing a lowering of a pull-up. You're still working up all your pull-up muscles in the back, your lats, but you're gradually lowering and lengthening it under load. And if we look at what is happening in Eloy's case here, he was lengthening his pec muscle under load. So he had to squeeze with all his might to stay on here. And he's squeezing with all his might, but his body is still pulling him down. So that force just became too much and the tendon completely ruptured. So what do these pec ruptures look like? So this here is a weightlifter. You can see there's a lot of swelling in this area. When I see that level of swelling, I am worried about a tendon rupture or a muscle rupture. Now here you can actually see that there's a divot in that space. So if you look at this muscle right here, your pec is located here. And essentially, it inserts onto this part of the arm. So you can see that it's completely released and there's a nice divot there. Now, usually these can be treated in one of two ways. Non-operatively, conservatively, put them in a sling. You only really do that for elderly patients, patients whose surgeries are dangerous for, or those who won't be using their pecs. So not Eloy in his case. The most common treatment for this is really surgery. That's the only way you'll get your full strength back. And depending on where it tore, the surgical options are a little bit different. But mainly, they put it back together and there's a pretty extensive protocol when it comes to getting better. So news reports have stated, which I'll put up there, that Eloy will be out for 5 to 6 months. And this makes complete sense because he's going to need the operation, he'll stay in a sling for a bit, then he has to work on passive range of motion, progress to active range of motion, so moving by yourself, and then work on strengthening. In surgical rehabilitation protocols, they've actually asked the athlete not to increase their bench press more than 50% of their 1 rep max until at least 6 months post-operatively. So in Eloy's case, he will not be doing flies or bench presses to any degree until 6 months post-op. Now, depending on how much of a pec he is going to need, this will determine whether or not he can return to play. You know, in baseball players may actually not need as much pec function as other areas. Think about bench pressers and weightlifters. Will he ever be doing that again? I would highly doubt it, because one of the biggest complications is that you can re-rupture your pec. 5 to 7% of people have that. And I wouldn't advise him as a doctor to be, trying to steal home runs and really putting that arm over and extending that tension along the pec. he's at really high risk for re-rupture in that case. It's really sad to see Eloy get injured in a preseason game. Probably not the best course of action for him to really put his arm in this compromising position. You know, the good thing is that once he is healed, these tend to have really good outcomes, and he'll be back with minimal issues to pec function in the future. If you have any questions or comments, leave them down below. If you want to stay up to date on future videos I do, please like and subscribe. For now, that's all.